I'm Dr. George Ampat. I work as a consultant orthopedic surgeon in Liverpool. I'm also part of the team that leads the musculoskeletal special interest group of the British Society of Lifestyle Medicine. This group is open to all healthcare professionals who believe in the principles of lifestyle medicine for the treatment of musculoskeletal pain and disorders. We are planning to meet online once a month on the third Thursday. We have also set up a Facebook group. The Facebook group is called Lifestyle LM for MSK Pain. I am very grateful to the rest of the team who are facilitating this. They are Mr. Rajiv Bajekal, Mr. James Smith, and Dr. Deepak Ravindran. Our first meeting was on 20th July 2023, and we discussed a very interesting study from Denmark that was published in the British Journal of Sports Medicine in June 2021. The study was a prospective observational study involving 16,499 patients with hip or knee arthritis. The participants were recruited from the not-for-profit charity Good Life with Osteoarthritis in Denmark. It's also called GLAD. GLAD. The outcome measures evaluated was the change in the proportion of analgesic use. For the study, the analgesics were stratified as opioids, non-steroidal anti-inflammatory drugs, and paracetamol. The intervention was an 8-week education and exercise program for patients with hip or knee arthritis. Following the intervention, the overall pain scores decreased by 13.2 points on a 100-point visual analog scale. In addition, at the beginning of the study, 62.2% of the patients were using analgesics. At the end of the study, that number had decreased and only 44.1% of the patients were using analgesics. This means that 18.1% of the patients stopped using analgesics following the education and exercise intervention. The average age of the patients was 64.9 at the start of the study. The average pain scores on a scale of 0 to 100 was 47.5, and it finally decreased to 34.3. In Table 2, we can see the further data. In the first row, we can see that 6,230 patients were not taking any analgesics or painkillers at the beginning of the study, but by the end of the study, in 8 weeks, it increased to 9,224. The further rows show the decrease in the number of patients consuming paracetamol, NSAIDs, and opioids. The reduction in the consumption of opioids is noteworthy. At the beginning of the study, 1,156 patients were using opioids, but following the 8-week intervention, it decreased to 742. It was an actual total reduction of about 36% using opioids. The intervention was an educational program for 2 weeks, followed by an exercise program for 6 weeks. During the exercise program, patients attended an exercise class for 1 hour twice a week. The exercise program was called NEMEX, and it had 4 groups. Exercise Circle 1, Core Stability, Postural Function. Exercise Circle 2, Postural Orientation. Exercise Circle 3, Lower Extremity Muscle Strength. Exercise Circle 4, Functional Exercises. Basically strengthening exercises for the lower limbs. Overall, the study showed that an 8-week education exercise program helped 18% of the patients to stop taking painkillers. Another 34% decreased the number or type of painkillers. 7% of the patients were using opioids in the beginning of the study, and that decreased to 4.5%. This amounted to an absolute reduction of 36% of users on opioid medication. One of the pillars of the lifestyle medicine is activity and exercises. This study clearly shows how even a short exercise program can decrease the use of analgesics significantly. This study clearly shows that lifestyle medicine can help our enormous waiting list for musculoskeletal disorders. Exercise and education programs can also lower the burden on healthcare costs by decreasing the use of painkillers or analgesics. More importantly, patients can be empowered to self-manage and also reduce harm by consuming less medication. I hope that was useful to you in your practice. I would like to let you know that the British Society of Lifestyle Medicine is organizing its annual conference in Manchester between 21st and 23rd September 2023. The details of the conference can be viewed on their website. The conference is very educational, and I sincerely hope that each one of you would be able to attend. Thank you. Hoping to see you soon.